So welcome everybody. I'm going to be talking about today about does natural medicine work for ADHD? So we need to kind of break this down a little bit because whether you're deciding to use natural medicine with medications or you're wanting to just use natural medicine without medications, there's definitely different approaches when it comes to this. And I get this asked a lot, like what natural medicine works? Does it actually work for ADHD? Can I use it? So the very first thing that you have to understand when it comes to using any natural medicine, whether you're going to use nutrition, different supplements, anything like that, you have to realize that you got to run some testing. You know, people, a lot of times parents or even just anybody will just decide they'll read something online or they'll find something on Facebook, like in this Facebook group. So you got to be a little careful here is you got to first run to see if your child or for yourself as an adult who has ADHD, if you have deficiencies in the first place. So very first thing is testing. Okay, testing is so crucial. And when it comes to testing it looks like it's a little slow showing up on the testing part. Okay, when it comes to testing, you got to run some labs. You got to run labs and all different types of labs. When it comes to ruling out certain things for ADHD or other types of symptoms, for example, if you are very inattentive and you are having trouble focusing and possibly have low energy or high energy, this could lead to thyroid issues. This could lead to also possibility of anemia. This could lead to also possibility of adrenal issues. This could also be a possibility of malnourishment in the digestive tract. So definitely running specific labs to rule out the possibility of what it could be contributing to the ADHD symptoms. Because there's lots of different ADHD symptoms that we experience on a regular basis, but there could be other underlying causes causing those specific types of symptoms. So once you've actually run the labs, then we can move towards treatment. Okay, first testing, then treatment. Whether it's using supplements, whether it's using medications, you always got to run testing first, then it goes to treatment. Okay, then the next step, once we've actually identified what is out of balance and we can implement treatment. Now it needs to be customized, okay? A customized treatment plan. Very important to have a customized treatment plan versus just like you go and see your psychiatrist or psychologist and they do an assessment on you and they try this medication. I don't like that word like try. Try me as a guinea pig. Try this. Oh, that didn't work. You go back, okay, then try this one or increase the dosage. To me, that's not customized. So the reason why we should run testing first is so that we can customize a treatment that's going to be best and most effective for the ADHD. Now, there's a lot of doctors that don't do this, but there is some that do. And it boggles my mind that doctors will not do testing first before even prescribing medications and even supplements for that matter. It really makes more sense if you can actually run some tests first. And you might be asking, okay, what's that kind of test? Well, we can run neurotransmitters to see which actual neurotransmitters are out of balance. Then we know actually what types of amino acids, what types of supplements to implement to help with those types of neurotransmitters that possibly might be out of balance. Or if you want to use medications, same thing, because those medications are usually helping with the feedback loop. It's blocking the feedback loop of dopamine or serotonin to increase levels of dopamine or serotonin, depending on which types of ADHD medication or antidepressant or anxiety medications that you are taking. That is the concept. But a lot of cases, you were given those medications without even running any testing in the first place. Also, to rule out all the possibilities of being digestive, other hormones that could be contributing to the ADHD, you have to make sure that you're running different tests. So, like hormones, okay? So hormones, digestive, you want to make sure that you're ruling all these different kinds of tests out before implementing treatment. And then I also mentioned about neurotransmitters, okay? Then, once we've implemented a customized treatment plan, this is where it's backwards thinking in most cases. The next step should be mindset strategies. So actually, give me a second here. Sorry, my drawing's a little bad today. But yeah, so it should be mindset strategies. Okay. So the reason why this is backward thinking, a lot of the mindset strategies, a lot of psychologists, therapists, coaches, whoever you've worked with, they do this first when really it shouldn't be. Because if we haven't fixed things from the physiological, biological side of things, it makes it really difficult for the mindset stuff and strategies to work with people with ADHD. That's why people who usually go work with a therapist or psychologist and your child's just not getting it, or you as an adult are just not getting it, working on your time management or, organization, different dysfunctions that you're dealing with, and it's just not working. It's because you haven't started here. Okay. Let me just kind of change the color here for a second. You haven't started here. This is where you need to start, is running testing. Okay. Now, some of you guys have probably maybe run some testing, but it really should start there, not the other way around. Because sometimes it goes right here. Let's implement some strategies. And then they go to treatment. They kind of go backwards. And then maybe over time, then they finally get to testing. And that's just backwards. It's definitely backwards, not the way to do it. It needs to be testing first, then a customized treatment plan. Then you can start implementing more of the mindset strategy stuff. Okay. So does natural medicine work? Yes, it does. I've seen it hundreds and hundreds of times, but when you do it in the right order. Okay. So the right order, like I said before, is starting with the testing, creating a customized treatment plan, then implementing the mindset stuff. Okay. That is how you're able to see how natural medicine can work. Not by just trying this type of supplement, trying this supplement, trying this type of medication. And by the time, you got your basket full of different types of things you've tried, and then you just think, okay, natural medicine just doesn't work, or treatment for ADHD just doesn't work. It's because you've been doing it in the wrong order. You got to do it in the right kind of order to be able to get the results that you're looking for. Now, if you are seeking for how do I do this? How can I have a better focused mind for my ADHD or for my child? Well, I do have a free training. If you haven't watched it yet, it does go over my proprietary process of helping people get that focus and optimal mind specifically for people with ADHD or just have, attention and focus issues. And maybe you haven't been diagnosed with ADHD yet. And I do have it I'll leave it in the comment section below and the description below as well. And that way you guys can actually watch that training, and it really, really gives a lot of benefit of understanding how this process works and how natural medicine can work for you when you learn the concepts in this training. So go ahead and watch that. And if you have any questions, go ahead and leave it in the comment section below, and hope you guys enjoy this training. And until next time, I'll see you guys later. Thanks.